Hello, and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Before we get started with today's show, please hit the subscribe button below. It helps us out a lot, and you'll stay up to date on all our upcoming shows. You can also check out additional information on our website, Instagram, and Facebook. All those links are below. Now, according to research, tinnitus, commonly described as ringing in the ears, affects about 749 million people worldwide. And recent reports and a handful of studies suggest an association between more persistent hearing problems and COVID-19. Studies found that about 15% of COVID-19 patients experienced tinnitus, while roughly 8% reported hearing loss. And in a survey of nearly 650 COVID long haulers, which are those experiencing long-term health issues from the virus, about 1/3 of those experienced earaches and 2/3 had dizziness and vertigo. Additionally, the World Health Organization is investigating rare instances of hearing loss and other auditory disturbances associated with the COVID-19 vaccinations, primarily the Pfizer-BioNTech shots. But experts do caution there's not enough evidence yet to draw a direct link between SARS-CoV infections, vaccines, and hearing problems. But I think it's an important question to be asking, and there are studies underway. So today in Discovering True Health, we are going to be learning more about hearing issues, specifically tinnitus and vertigo, what they are, common causes, and treatment options to help manage and mitigate each condition. So my guest today is Dr. Amy Sorrow, a clinical audiologist who specializes in the area of hearing loss, dizziness, and tinnitus. So thank you so much for joining me today to have this really important conversation.
Thank you so much for having me on the show. I'm excited to be here.
Now, as I mentioned at the top of the show, reports and studies are showing tinnitus and vertigo are possibly associated with COVID-19 and some rare instances with the vaccines. And experts do say it's common for some changes in hearing to accompany any viral infection of the upper respiratory tract. So be an expert in the area. What have you learned from your work and studies around how COVID and possibly the vaccines may be causing these types of issues for some?
Yeah, so it's definitely, you mentioned a lot of great information already. It's definitely an interesting point of research right now. And as you suggested, we have no conclusive studies right now. It's just too new. We haven't seen enough research come in to be able to make strong statements about COVID-19 in relationship to hearing loss, dizziness, and tinnitus. However, I say tinnitus, tinnitus, it's this, both are considered.
Potato.
Exactly. So yes, it's interesting. There's a combination of things going on here. So we have, during the pandemic, I myself have normal hearing, but I experienced this as well. As soon as people started wearing masks, I realized, I can't see their face. Especially if they're wearing a mask, I'm wearing a mask, maybe at the checkout, they're behind a plexiglass window. So that's going to muffle the sound right there, along with the mask, and then the lack of visual cues. Anyone who had any hearing loss, where let's say they were a borderline hearing aid candidate or had some degree of hearing loss, struggled that much more. They became more aware of how much they struggled. And so that's one thing. There's just more awareness of hearing and how important that is for communication and understanding. But then you're absolutely right. We know that viral infections can be related to sudden changes in hearing, onset of tinnitus, also dizziness, because the inner ear is a very delicate organ, and it has, just a small blood supply. Anything that disrupts the blood supply to the inner ear or changes the metabolic milieu, if you want to call it that, can have an effect on hearing, most definitely. And we know with COVID-19, one of the things that we see along with that is low blood oxygen levels. So reduced oxygen can have that effect, on the inner ear space, which is very delicate. And so while we don't know conclusively that these things are linked, there's good reason to understand why there's this conversation happening right now.
Right. It's kind of when you understand the physiological aspects of hearing and what affects it. I mean, like you said, the low oxygen level, I know as well. Inflammation is a big one too. When it does inflammation affect hearing, I would assume it does.
Of course, yeah. Anything that can affect your overall health, cardiovascular health, diabetes, blood pressure, anything that could change that space metabolically in your whole body can have an effect on your hearing as well. We also see, for example, people who have autoimmune disease. There's autoimmune inner ear hearing loss or fluctuations in hearing that we see. It's more rare, but anything that affects your whole body can have other effects on, areas of your health and well-being.
And would that be the same with the possibility of the vaccines affecting as well? Somehow these people are maybe having more of a negative reaction at some level physiologically.
Again, that's very possible. As we're discussing, everything is still new. And so the research is still, it's all very fluid in terms of what we know at this point. But I think that there's could certainly be some truth to that. And we'll see it borne out with the research, hopefully in the coming years.
Right. Yeah. So interesting. Before the show, I didn't realize there was so many people impacted. And there are like a lot of Facebook groups, people that are kind of the same way COVID long haulers. Myself, I'm a COVID long hauler. So we had our own Facebook groups where we'd all share information. I've actually seen there's some Facebook groups out there for those that are suffering from hearing issues from, the COVID and vaccines, et cetera. And they're kind of all trying to figure it out amongst themselves and sharing information. So it's quite fascinating. All right, so let's get into some details of what these impairments are, what we can do about them, starting with tinnitus. What is tinnitus and its symptoms? What can cause it and what's going on physiologically if we're experiencing it?
Yeah, so with tinnitus, it in itself is actually just a symptom. It's not an illness. The thing that can be detrimental for health is the consequences that can come along with it. And when I say that, what I mean is for some people, they have a negative association with the sound of their tinnitus. It can sound like ringing, buzzing, humming, chirping, electrical power line noise. People describe it in a lot of different ways. For some people, they start to associate that with discomfort or something that they don't like, and it becomes a negative feedback loop. That is much more detrimental to a person's health than the actual, existence of the tinnitus.
It's kind of the fight or flight kind of gets you in that.
Exactly. So in and of itself, it's not something nefarious. It's not something where you have to worry, oh, I have this going on. I need an MRI. However, if you have some other symptoms that accompany it, then it's worth some investigation. So for example, if you have a sudden change in hearing in one ear, if you have tinnitus just in one ear, if it's accompanied by dizziness or other symptoms that come on with it, that warrants an investigation. And I would say it's best to find a local ENT in your area or speak with your primary care physician about that, because that is probably something that needs to be addressed, or, we just want to rule out that it's not something else going on.
Understood. Now, research shows there are currently no medications or treatment options that will completely eliminate tinnitus. But the good news is, and you talk about this in your work, there are some options that can change the effects that it has in our lives. So what are some management strategies that you've learned about and you work with your clients, and what can we do to mitigate the symptom?
Absolutely. So for many people who have that ear noise going on, they often have some degree of hearing loss as well. So that's the case for about 80 to 90% of tinnitus sufferers. And so if that is the case, it can be helpful to get some amplification, some hearing aids. The reason being, when you have hearing loss, our understanding of the mechanism behind, the brain generating these ear noises is your brain says, hey, I used to hear these sounds and I'm not hearing them anymore. And it starts to fire off sounds in your brain, so to satisfy that urge to be able to hear something. And so the sound is actually not coming directly from the ear. It's kind of triggered by the ear in a way, but it's really the brain. And so when you Yeah, when you send sound in and the brain starts to hear those sounds again, it says, oh, I can tone that down now. I don't need to do that. And so that's one mechanism that we understand. A lot of people find benefit or relief from their tinnitus just by wearing some amplification. The other part of it is you can think of it as, let's say you're sitting in a dark room and you light a candle. It really stands out, right? But if you're in a room where there's light and you have the candle, it blends in much better. So if you listen to something that can work as a mask, I know we talk about the pandemic and masking, but this is tinnitus masking. You can listen to some nature sounds or something that's very calming and soothing for you. Some people like white noise. Other people find that that is a little too abrasive. Some, it's very personal in terms of what people like. Some people prefer brown noise, but any kinds of noise like that will help. And then what you can also do are management strategies, and these would be lifestyle modifications. So just taking good care of yourself, making sure you're getting good rest, making sure you're staying hydrated, avoiding alcohol and tobacco, these kinds of things, that's going to help. And, stress management is hard. It's hard to reduce stress, but doing that in the ways that you can is very helpful.
Interesting. So the root cause of it could possibly be hearing loss.
Yes, for many people it is.
That's very interesting. Now, can tinnitus go away at any point if it suddenly comes on? If it's possibly something besides hearing loss?
So it can. And when I say, the majority of people do have hearing loss. However, there are other things that can be associated with tinnitus. So, for example, someone who suffers from allergies can find that it's made worse when they have sinus congestion going on or if they have allergies. So obviously that's going to be sort of transient depending on how they're doing on a particular day. Someone with migraines might also experience it, and that might accompany a headache or a migraine. So those are more individual, more specific situations. For most people, we consider it chronic if it's been going on for 6 months or longer. At that point, it's less likely that it's going to just stop on its own. Or completely go away or dissipate. Again, using those management strategies can really help, but that's what we know, generally speaking.
Interesting. Now, what should we do if we start experiencing these types of symptoms? And it seems like it's more persistent. Are there specific tests that we should be getting at that
So
point?
certainly anyone who has tinnitus, and especially if it's bothersome for them, they should go to have a comprehensive hearing evaluation, because that's good to know if you have hearing loss, like we're talking about, then okay, there is something I could do about this, or at least an option I could consider. You also want to know if you have a difference between your ears, again, because if you have a difference between your ears, there's a very small chance, it's a rare situation, but there is a benign growth on the hearing nerve called the vestibular schwannoma. It affects less than 1% of the population. But it can be, if you have a difference in your hearing, that's something that you would want to just look into.
Understood. So, I would assume if it's not a hearing, let's say somebody had COVID and the tinnitus comes on, maybe associated with that, would that be more of like the lifestyle things with reducing inflammation and kind of going that route as far as mitigating?
Yeah, I certainly think those are helpful strategies to try. And that's a good question in terms of, someone who is experiencing long COVID and had that as a result of COVID. I think that would be interesting to find out more about how that works for people. If once they start to feel better, if also there are other symptoms that are lingering, if those can go away. So those are great questions that I don't have an actual answer to, but I would assume that it's the same as what we generally see with most tinnitus sufferers, where once it's been there for 6 months, it tends to be more long term at that point.
Right. Yeah, I mentioned that because I'm a COVID long hauler and I suffered for about 2 years with all these symptoms. And once I started with, I did all the testing for food allergies and and started changing my diet and removing anything from my diet that caused inflammation, and did lifestyle changes around that. And that made a huge difference with my long hauler symptoms. So yeah, I'm curious if that would help others as well with that particular. I didn't experience any hearing issues myself, but I have personally struggled with bouts of vertigo at points in my life, and it can be very debilitating. And there were days when I could not get out of bed because of it. So let's talk a bit about vertigo. What is vertigo? Its symptoms, what can cause it, and what's going on physiologically if we're experiencing it.
Yeah. So vertigo is the sensation of movement when you're actually not moving. So it feels like the world around you is spinning, sort of a rotary sensation, but you might actually just be sitting still or even lying down. So we know that the most common form of this, first of all, if it's rotary motion, it is in most cases to do with the inner ear. And the most common form of this is something called BPPV, which is benign paroxysmal positional vertigo. And it's called benign, but it's really only benign for the person not experiencing it, because it can really feel like you're on a roller coaster. And what it is you have these crystals in your inner ear. So your inner ear has two parts to it. There's a hearing portion and there's a balance portion. In the balance portion of the ear, you have three semicircular canals, and there are these little crystals. We call them crystals. They're like little grains of sand. And sometimes they'll just break off and come loose, and it's not noticeable. Other times they kind of get stuck in one of the canals and need some help to get back to where they need to be. So it's kind of like if you shed a nail or hair or something like that, you just have a piece that can become lodged in there. And luckily, this is a condition that is easily treatable with a maneuver, for example, called the Epley maneuver, depending on which one of these canals it's in. And once it's been repositioned, for about 80% of people, they're fine. That takes care of the problem. Other people, if they've hit their head, or if there's something a little more complex to their situation, might take a few more maneuvers. But that is the good news. It's something that's very easily treatable.
Right. Yeah, it's good to know. I was thinking maybe head trauma could
It
cause
certainly
those
can.
little crystals to jump out of place. And what types of testing should we have done if we're experiencing vertigo symptoms?
Yeah, so if you have vertigo, in most cases, if it's a BPPV situation, the most common situation is you're rolling over in bed or getting out of bed the next morning and you get a little bout of some spins. That is very common because those little crystals, if they become dislodged overnight, they sort of, calm down there. And then as you get up, they're jolted to move, and that triggers that dizziness, that spinning sensation. If you have that, a lot of times your primary care physician or an ENT office, a physical therapist office, anyone there would be able to check you for that condition. And what they will do actually is have you turn your head a little bit to the side and then lie you back on the right side, lie you back on the left side. And then they're looking for movements of your eyes, which are triggered by what's going on in the inner ear. That's a sign, oh, okay, the crystals are out of place. We need to reposition this left ear or this right ear. So yeah, it's all connected.
So interesting. Now, let's say, is there ever cases where it's not the crystals being out of place? And if so, are there other treatment options for vertigo? And in that case, would it be something that goes away over time if it's not just an adjustment for the crystals being out of place?
Yeah, that's a great question. So there are other forms of vertigo. For example, one called Meniere's disease, which I'm not sure if you're familiar with. This is typically affects one ear. So let's say a person has Meniere's disease on their right ear. What happens is their inner ear will, at times, the fluids inside sort of expand, and it causes muffled hearing. They often hear like an ocean sort of noise, the tinnitus sound, and then they may have bouts of dizziness, vertigo, where things are spinning, and unfortunately it can last for hours at a time. Yeah, so we are still learning about this condition, but what we do know is that it responds well to sodium reduction. So anyone who has that type of situation going on, Meniere's disease, is advised to really limit sodium to, 1,500 milligrams or so a day. Going above that, a lot of times, if someone goes out to eat where there's a lot more salt in the food,
Mm.
I've heard many patients where it's just triggered almost immediately for them. So being mindful of that, preparing your own food or just considering the sodium intake, that can make a very big difference in that case. Also, migraineurs sometimes experience the vertigo as well. And that has to do with changes in blood pressure and other phenomena going on during a migraine that can trigger that sensation, and that needs to be more closely managed with a neurologist or someone else, perhaps with medications or ways to prevent the migraines from occurring, which then hopefully reduce all those dizziness symptoms. But some of that also has to do with diet. So there are migraine diets where you may be asked to avoid dairy or cheese, red wine, chocolate, caffeine. Those kinds of things can really help as well.
Interesting. Well, thank you for sharing all that information. That was really informative. And finally, how would you say our hearing impacts our overall health and wellness? And do you have any great tips as well around prevention when it comes to any of these types of hearing related issues?
Yes, absolutely. So with hearing, it's connected to our overall well-being in a lot of ways, actually. So as we were talking about at the beginning, it's affecting how we communicate in the world, how we're able to understand and communicate with other people, which in turn also affects our mental health and well-being. Because if we are not able to connect with people or feel left out, isolated, that really has an effect on a person's overall well-being. It can make them feel depressed, can make them anxious, maybe avoid even certain situations because they don't want to feel embarrassed or left out. So that's one thing. We know also that changes in your hearing can be due to other health changes. So, for example, those with diabetes or those with cardiovascular changes or health problems, they can also experience changes to their hearing. So, if you let's say have a hearing test and it's the first one you've had, and you're informed that you have some hearing loss, it could be a sign of something else as well, depending on the configuration of your hearing loss and other factors. So it's a sign of overall health and well-being in terms of mental health, in terms of physical health, and actually even in terms of financial health. So there was an interesting study from the NIH recently. I thought this was very interesting. People with untreated hearing loss over a 10-year period spend on average $22,000 more in healthcare costs than those who receive treatment or don't have hearing loss.
Wow.
And yeah, so it even affects your financial health. And if you think about it, it makes sense. When you go to the doctor, if you're not able to understand, oh, do I need to take this medication once a day? Or did he say once a week? Or what was that again? You're having trouble just getting the words. And so you're not able to make memories of what was said or maybe fully understand what was said. And then also on that same note, it affects your cognitive health as well, because when you have hearing loss, it requires more listening effort to pick up the words, making it harder to create those memories of what was said, which can then exacerbate if you have some dementia or some cognitive things going on. It can make it that much worse also.
Right. Wow. Thanks for sharing that. I never, I guess, kind of linked that having a hearing issue, there could be some other root cause physically behind it. I didn't know it was kind of maybe a symptom of something else.
Mhm.
That's really, really great to know. And what about preventative? Are there any preventative or things we can do to, keep our hearing health in check and healthy as long as possible?
Course, yes. So things that are good for your overall health, like we said, are also going to be good for the ear health. But if we think in terms of hearing loss, you can have environmental contributors. You can also have genetic contributors. So some of us are born with hearing loss of some degree.
Mm.
Some people are more susceptible to developing it later on in life, depending on their family history. But the one thing, so we can't control our genes necessarily, but the one thing we can control is our environment. And right now we're seeing this with a lot of young people actually, that where, the earbuds and the headphones are very popular. And it's great, right? You can listen to music and have, nice, when you're working out, you can listen to something that you enjoy. But if you overdo it and turn it up too loud, you can cause damage there. So we are seeing that with the younger generation, that we sometimes see evidence of that.
Premature damage.
Yes. So with noise, what you want to do is limit it where you can. So when you're listening to music on your phone, there's actually a way in the settings on an iPhone, also on an Android, where you can limit the maximum output. So that way you don't go over that dangerous limit, even if it's your favorite song and you want to turn it all the way up. So I do that myself. I limit it to about 70% of the maximum. And another good check, rule of thumb, is to, if you turn it up, it shouldn't go over 80 decibels, which, if we don't know what that is, if someone's standing about an arm's length from you and they're talking to you, you should be able to hear them over what you're listening to. Then it's an okay level.
Wow, that's a great way to understand decibels.
Yeah.
And do you think it's more detrimental with the earbuds and the ear, devices that go directly into the ears, that as opposed to just listening to music on a speaker?
It certainly can be. It depends on an individual's ear canal geometry. So it depends, if you have a small ear canal or a larger one, that's going to change how loud things are. So that's, of course, very individual. On their own, earbuds, they're not problematic as long as you listen at a safe volume.
Okay, good to know. Now, for those who want to contact you and learn more about the work you're doing or work with you, how can we do so? And can you also share with us the types of programs and how you work with clients, as well as any other great resources that we can all check out?
Absolutely. So my website is my name, which is AMY, and then S is in Sam, AROW.com. I'm happy to connect anyone who's interested. I also put content on my blog on these topics, so there's information there as well. Anyone who does have concerns with tinnitus, I would encourage them to also look at the American Tinnitus Association, which is ata.org. They also have some excellent resources, as well as, so I'm an alum of the University of Iowa, and Dr. Tyler is one of the best tinnitus researchers in the field. He is a wonderful source if anyone has specific research type questions or they're really needing some additional support as well.
Oh, beautiful. Thank you for sharing that, the extra, the links and information, because it's definitely something I feel like a lot of people maybe are struggling with it and they don't know where to go. So I will post links to all those below for everyone listening. And thank you so much for joining me today and sharing with us this really vital information around vertigo and tinnitus. I know there are many in the world impacted by these issues. So thank you for all the work you're doing in this field.
Thank you so much. I appreciated the opportunity to share it with everyone.
Remember, knowledge is power. The more you understand about your body, the better you're able to stay healthy and prevent disease. And a reminder, I am not your doctor, so please don't take this as medical advice. If you have specific questions about your healthcare, feel free to reach out to your practitioner or an expert like Dr. Saro. If you like this video, please like and share with others. This information could really help someone you may know. And if you haven't already, hit that subscribe button to be sure you don't miss out on our future shows. And I will see you all next Wednesday on the next episode of Discovering True Health.